Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
As the government shutdown begins, Maryland faces immediate fallout. Furloughs, economic strain, and threats of mass firing under the Trump administration's downsizing agenda. Here to talk about what this means for federal workers, local businesses, and the region's future is Congressman Glenn Ivey, representing Maryland's 4th District. Congressman Ivey, thank you so much for joining me.
Thanks for having me.
We're in the midst of another federal government shutdown. What is different about this round?
Well, one of the big differences is that President Trump has threatened to RIF federal government employees instead of just letting people come back to work, come off furloughs once the shutdown's over. I think the lead up to that, though, is he's been essentially trying to force out as many government workers as he could since he got here on January 20th. So it could just be more of the same, but that's a big difference. The other part, too, though, I think is, we're trying to link this, we being the House and Senate Democrats, to the health care cuts. The cuts that were made and the quote-unquote big, ugly bill that they passed, $1 trillion to Medicaid, biggest in American history. And so trying to reverse those cuts, cancel those cuts, has been a big focus for us. And I think that's different than previous shutdowns.
So what are you hearing from your constituents? How have the cuts that have been going on all year and now the furlough affecting them?
Yeah, I think there's a lot of concern. There's a lot of fear. There's a lot of anger. People got forced out of jobs that they'd had in some instances for 10, 20, 30 years. They were exemplary public servants doing a great job, and some of them they were doing great work to help the American people immediately. I had one person come up to me who was working on Alzheimer clinical trials that were terminated. And, you can't just start that right back up again. It's not like flipping a light switch. So there are lots of federal workers doing that kind of work. And there are others who serve the public directly, answering questions, maybe it's Social Security or Veterans Affairs. They're sad that they can't do the work that they've been trained to do.
Maryland has one of the highest concentrations of federal workers in the country. So you have the NIH, you have the Social Security Administration headquarters. How is that playing out in your local communities?
There's a lot of concern for sure. NASA's in my district. One part of NOAA's in my district. We've got a lot of federal installations in our district, Army Research Lab, that have been hurt by what the Trump administration has been doing, not just enforcing federal government employees out, but in cutting contracts, cutting grants, and those sorts of things that are really undermining their efforts to do the work. So, I think there's great concern there. On the other hand, though, I think they also understand that the health care piece of this, trying to make sure we restore the Medicaid cuts or correct the Medicaid cuts that have been made. Also, you've got the Affordable Care Act. There's an expiration for the subsidies that have been part of that. Some people are going to see their rates or their premiums jump, in some instances even double. And so the impact on that's going to have a devastating hit on health care coverage, not just in this region, but across the country.
Do you think people understand what's coming down the road with these healthcare premium increases?
I think to some extent, with respect to the Medicaid cuts, I think it's clear the public got that this was not a good thing. There's a lot of people who benefit from Medicaid, a lot of seniors, for example, a lot of the disabled, a lot of young kids that need it as well. So they understand that they need it and could lose it. The healthcare subsidies with respect to the ACA, people will get that when the notices hit their box starting this month, that their premiums have doubled. They'll know what that means. Some of them are going to have to drop their coverage, for example. So I think it's going to be a big impact. Unfortunately, we're trying to preempt that and see if we can get a deal that opens the government back up, but also restores these benefits that the people have come to rely on.
Well, typically open season is going to begin on 1 November, just 30 days from now. Is there enough time to make these kinds of changes before open season starts?
I think so, but that's one of the reasons we're fighting against. The Republicans are saying, hey, look, let's just pass this continuing resolution. We'll kick the can down the road 7 weeks, and we can try and work it out during that time period. But because of the open season timing, as you pointed out, that makes it harder for people to do it that way and could force people to miss the opportunity. So some people might have to make the decision about whether they drop it or not before the open season, before November or December. So we want to move now. Also, by the way, we've been trying to push these changes We didn't do this at the 11th hour. We were trying to do this all summer after the cuts were made. And everybody, all the House Democrats except one, voted against the bill that led to the Medicaid cuts of $1 trillion. So we've been fighting this for months. This is not a new thing. And the Republicans know that.
I'm speaking with Congressman Glenn Ivey. He represents Maryland's 4th District. I want to come back to some Maryland specifics here with the end of the DRP program on the 30th of September and the end of many contracts that would have been funded with 2025 funds. Now people can begin to file for unemployment, and people who are furloughed are entitled to unemployment. What do you think is going to happen in Maryland to your statewide unemployment as these factors all come into play?
It's going to be a big impact for sure, and not just on the unemployment insurance. You know, we're trying to do things, for example, to help people with forbearance for their mortgages. We don't want people to lose their houses because of, being unfairly forced out of their government jobs. There's going to be a lot of ripple effects, too, from the local economy and the like. 85% of federal workers are, outside of the DMV area, so I think there's going to be a national impact there. And then when you layer on top of that the Trump tariffs that are forcing prices up for groceries, for example, across the board, I think you could be looking at a recession. I saw one economist say we might be looking at stagflation nationwide, if things keep moving in this direction. So it's very risky. We're hoping to get the Republicans to change course, but they've been very resistant so far.
The federal government has certainly been an economic engine here in the DMV, but one of the reasons for that is it attracts a lot of young professionals to the work. How do you see that playing out in the future? Are more or fewer people going to be interested in serving in government as a result?
I mean, I wouldn't be shocked if it's fewer, because a lot of the things that drew young people to this kind of work, take at NASA, for example, grants for, training the young people, internships that help them get in, fellowships that help them get started. Trump administration's cutting a lot of that, and also cutting the overall contracts to NASA installations and a lot of the science, NIH and CDC and the like. So, the usual tracks that young people were taking to get into these lines of work, especially on the science and tech side, for some unknown reason, the Trump administration is contracting, and I think that's going to hurt us across the board, especially in our competition with China as we race to move forward with AI or quantum computing and the like.
Do you see opportunities for Maryland to move into some of those other sectors that are growth sectors in the federal government?
I mean, I guess we'll see, and then part of that's going to be determined in part by, how deep these cuts are and how extensive they are, and how long it stays in place. I know there's been an effort to diversify the economy in the DMV for some time now, and this might help to spur that on. But at the end of the day, I don't think this is waste, fraud, or abuse. We had a lot of great programs we were doing, especially on the science side at NASA and NIH, that benefited not just the economy, but the American people in the world. And to have that undercut in this way, I think, is really tragic.
So what do you want Marylanders to know today as we sit on the second day of the shutdown? What resources are available to them? Where do they go to look if they need help?
Yeah, we're having a webinar tonight to try and answer some of those questions. ivy.house.gov. It'll be at 5 o'clock. You can go there on Facebook as well. I know the governor of Maryland just had a press conference. I think they're rolling out some options. There are other regional options that are being rolled out too, to provide sources of information for example, how to refinance a loan, or which banks or credit unions might be amenable to trying to help to extend payments and the like. So we're trying to figure out all of that. But we're also trying to make sure people stay up to speed on the information they get on how things are going with respect to the closing of the offices, who's essential, who's not, who gets furloughed, who doesn't, when people can come back. Apparently there are RIF notices that might go out today or tomorrow. We need to hear about, what's going on with those. There's also a lawsuit that's just been filed by AFGE to try and block the Trump administration from punitive termination. So there's a lot going on, and I know there's people's heads are probably spinning from all of this, but we're here to try and help and provide answers and fix the problem.
How do you think this all gets resolved? This feels like a shutdown that could go on for a while.
It could, but I think the two things that could change that would be, as I mentioned earlier, the notices that go out to say your health care premiums are about to double. Once a few million Americans see those and then get on the phone to their local members of Congress, that could help move the ball a little bit. The other one's Wall Street. Trump does seem to pay attention, especially to the bond market. I know there's been a rocky start so far today. We'll see how it plays out over time. But there's a lot of bad things that are going on in the economy, especially with the tariff piece. Hopefully the Wall Street can have an impact on the president's thinking, too.
I've been speaking with Congressman Glenn Ivey, who represents Maryland's 4th District. Sir, thank you so much for joining me.
Thanks for having me.
We'll post this interview at federalnewsnetwork.com/Federal Drive. Hear the Federal Drive on your schedule. Subscribe wherever you get your podcasts.